morning, everyone. Thank you for joining us on this webinar. So today's webinar's topic is diabetes reversal with keto diet, solution or setback. We thought this might be a very interesting topic to have a discussion on, primarily because there have been some questions on this from the previous webinars, and also we'd had messages from people who have been using Rubyroti as well as to what we think about keto diets. So be patient with us today. This is going to be Dr. Raghu is going to take a deep dive on the keto diets and the foundation principles of it, and whether it actually helps with diabetes management. So, and also we would have a small Q&A section at the end. If you have any questions that you'd like to have us answered, please put your questions in. We prefer that you actually do it in the Q&A section of the webinar. So if you can actually type in your questions in the Q&A section, we'd really appreciate that. And also, before we get into the webinar, I'd like to briefly introduce Dr. Raghu. Dr. Raghu is a founding member of Navrelia Foods. He's a practicing cardiologist at Emory University Hospitals in Atlanta, USA. He's interested and passionate about pursuing scientific interventions for public health. So as part of his research work, the culmination of his research efforts into looking at this diet solution for diabetes is Navrelia Foods, and one of the first products that we introduced in the market is Rubyroti. Having said that, now I'll pass it over to Dr. Raghu, and he can go over the keto diet, the foundation principles, and how does it play a role in managing diabetes. And Dr. Raghu, all yours.
Thanks, Dheeraj. Yes, Dheeraj, and welcome to the one more session of our webinars. And during our last few webinars, most of the people, lots of them were interested in knowing more about keto diet and its implications in diabetes, which I think needed a lot of attention too. And we thought we will come up with a webinar. And without further ado, let me just dive into this very important topic. Because keto diet has been in use since early 1900s, like 1970s, 1920s. People have found a significant impact on the incidence of epilepsy or the control of epilepsy in patients who have been given with the keto diet. So from there, the biochemists started looking at the various aspects as to how a keto diet can influence the general health of the population and the merits and the demerits of the diet. So let me just share my screen. Can you see my screen?
Yes, we can see your screen. Yeah.
Yep. And my voice is okay, right?
Yeah.
So, can diabetes be reversed using a keto diet? Do we have a good solution here, or is it a setback, or do we have any information regarding whether the diet is good, bad, or ugly? That's what when they talk about keto diet, when they talk about keto diet, good, bad, or ugly. So, first things first, what is a keto diet? We have three macronutrients: proteins, carbs, and fats. How we eat them, the proportion of how we eat them differs in different populations of the world. So it is just a method of rearrangement of the macronutrients. So what they did was they decreased the carbohydrates to bare minimum. And everybody must have heard about the Atkins diet, which has been very popular in the last decade or so, 2 decades, I should say. So what they do is they increase the amount of fats that you have in the diet. They decrease the amount of carbohydrates significantly. So it's not going to be a modest decrease of carbohydrates. You will see a significant decrease in the amount of carbohydrates that is included in your diet. So of the three macronutrients, the proteins, the fats, and carbohydrates, once you decrease one macronutrient, which is carbohydrates, which was the predominant source of fuel in the modern world, then we have to substitute that like with something else, which is proteins or fats. But proteins can only be taken at a certain level. And I told you in the last webinar also that the amount of protein intake should not exceed more than 1 gram per kilogram. Maximum which you can go is 1.2 in athletes. So protein intake has to be capped off at a particular level. And so the only other macronutrient that can be increased is fat. So in the keto diet, you have a stable protein content, but you'll have a significantly low carb content and a very high fat content. So there are multiple ratios of fats to carbohydrates and proteins in the diets. The usual, I can't say like, I mean, usual like because lots of diets like manipulate that. Some go for 4:1 ratio, some go to 5:1 ratio. And the carbs to protein ratio and the fats to protein ratio varies depending on the different diets which have been promulgated like in a different way. Okay. The most important thing, takeaway point here again is the best source of fuel of our body, of the human body, is fat. Hands down. Each gram of fat gives around 9 kilocalories of energy, whereas carbohydrates and proteins give 4 kilocalories per gram, respectively. Again, fats are the energy packets. So, how can we use fats? If you go into the biochemistry of the body, fats can be used when there is adequate amount of glucose in the body for energy production, or fats can also be used when there is not enough glucose that is present in the body. Why do we have these two situations? We'll talk about it. The most important thing is 99% of the time, or I shouldn't say 99, 95%, around more than 90% of the times, fats participate in the energy cycle of the body by using glucose as a substrate. So the common thing that biochemists talk about is fat burns and carbohydrate. So you have to have a certain amount of glucose for the fat to participate in the energy cycle. There are two different cycles. One is the glycolysis and the Krebs cycle. We're not going to go into those details. And that's not going to be helpful at all. But you have to understand that you have to have certain amount of glucose in the body for the fats to be converted into energy molecules. So in the absence of glucose, or when the glucose levels are extremely low, so in the absence of glucose, or when the glucose levels are extremely low, brain requires energy source. And unfortunately, brain cannot utilize the fatty acids because there's what is called a blood-brain barrier, and fatty acids cannot go through that. So body has devised a technique wherein in situations of extreme stress, which would be starvation, that would be the extreme stress, that a special mechanism where fats can be converted into energy molecules that can be effectively used by brain. So this is a special situation where in the absence of glucose, or when the glucose levels are extremely low, or when the glucose levels are extremely low, your insulin levels also go down. I hope I'm not confusing, like a simple thing. When glucose is not available in the body, that happens in extreme starvation. When the glucose levels are not there, there's no need for insulin. So there's no insulin production. So the insulin levels also come down significantly. In this particular scenario, these fats, which have been mobilized from the fat stores, will be taken up by the liver preferentially. And through a special process, the liver, the same oxidation process that you see on the left side and the right side also, they produce ketone bodies, and these ketone bodies can be effectively used by the brain for energy utilization of the brain. So this is a special adaptation for the brain. So again, the same thing, brain cannot use free fatty acid like other tissues, and brain needs alternative fuel. This alternative fuel source is ketones. And ketosis is a protection for the brain. That's how we started with that. And ketone bodies are end products of fat metabolism, particularly in liver. In the setting of low glucose levels. That is key, is an essential thing. So, and liver is the only organ that produces ketone bodies, and keto diet is mostly fat-laden diet. So what people did was, can we use these ketones for the energy source of the body entirely? Because in diabetes, the problem is we cannot handle the glucose load. We lose the ability of using the glucose. We lose the ability of pushing the glucose, which is in the blood, into the cells effectively. So we have what is called a resistance or decrease in the sensitivity of the insulin at the receptor level, or there may be a paucity, a decrease in the amount of insulin that is present, which happens in type 1 diabetes, also happens in type 2 diabetes in an advanced stage, what we call a burnout phase. These are the two extremes, and I want to remember that type 1 diabetes and extreme case of type 2 diabetes where you require a lot of insulin because you burn out your pancreatic cells. So the keto diet is a low carbohydrate diet, extremely low glucose, so you don't have any insulin. Very little or no insulin, you have ketone production, mainly to support the brain. And we, the dietary community in the world, and the biochemists, took advantage of this energy source and said, you know what, we can play with these ketones and start using ketones as a primary energy source and get away completely from glucose. So they came up with the concept of keto diet, which has an extremely low carbohydrate and a very high fat diet. So technically, in a normal situation, people who do not have diabetes, or even people who have diabetes, we're better off with the regular fatty acid metabolism, where we need glucose as a substrate on the oxidation that happens in every cell. So every cell which has a mitochondria can utilize the fatty acids which are mobilized from the fat stores to produce energy. But ketosis is a necessary evil as brain cannot use the fats. So a typical keto diet, as I've told you before, constitutes of fats and anywhere from 55 to 80%. So 4:1 ratio can happen, 5:1 ratio can happen, but there is a wide range of the amount of fats that you can ingest, or you can constitute a keto diet. Different diets have different mixes in that. And then proteins are around 10 to 20% of the total daily calories, and carbohydrates are extremely low, 5 to 10%. Our idea is to deplete the carbohydrate stores and then push ourselves into fat metabolism. So what are the benefits of keto diet? What is it that made people go after this keto diet? There should be some benefit. Otherwise, there's no point in going after a diet. So the number one is keto. When you eat a keto diet, because of the high fat content and because of high protein content, you have what is called a high satiety effect, meaning you'll feel full for a long period of time. Feeling full is a good factor because you'll be eating less. Number one. Number two, as the satiety index increases, meaning the number of hours that you're not hungry, you will be eating less frequently, which is what is required in people with diabetes. So a decrease in appetite stimulating hormones such as insulin and ghrelin when eating restricted amount of carbohydrate, is one of the key factors people say about the benefits of keto diet. A direct hunger reducing role of ketone bodies. Ketone bodies themselves have a decreased hunger reducing, just like your leptin. The body's main fuel source on the diet. Increased calorie expenditure due to the metabolic effects of converting fat and protein to glucose. So when you have carbohydrates, simple digestion of the carbohydrates produces glucose, and glucose level increases, and you use the glucose. It's a very simple process of utilizing glucose for energy production. It also requires some energy, but it gives a lot of energy. But when you have the fatty acid oxidation, when you have to have fats and proteins to help with the production of energy, which is finally either glucose production or participating in the Krebs cycle or in the production of ketones, it is a very energy dense process. It is a high energy process. And so you burn more calories, so that you take advantage of high catabolic state. But production of ketones is not a catabolic state, but oxidation of fats is catabolic. And so I just want to make sure these are all confusing things that we're hearing when you look at the literature, meaning ketone bodies production and fatty acid oxidation, two different things. And then increased calorie expenditure, I told you, and promotion of fat loss versus lean body mass. And so when you do not have insulin in the body, when the insulin levels go down significantly in the body, there is a preferential mechanism where fats are mobilized from the fat stores. And the proteins are conserved. So normally, when you go for a high carbohydrate diet, and when the carbohydrate rich diet has very low calories, meaning it's not able to meet the demands of meet your metabolic demands. Say, for example, you're getting 1,500 calories per day, and then you're spending 2,500 calories per day, and your diet has a very high carbohydrate level, then since the energy requirement is way below, energy production is way below the requirement, there is a big difference between the requirement, supply, and the demand. So the supply is very low and the demand is very high. So in the presence of glucose, when you have glucose, you have insulin. So when the insulin levels go up, insulin prevents fats from coming out of the fat stores. It promotes fatty acid movement into the cells. So fats will not come out. And so the other macronutrient that comes out is protein. So most of the other diets that we see, when you see a significant weight loss, not the keto, the other forms of diets, when you see a significant weight loss, the weight loss primarily is because of water loss. And number two, the protein loss, because protein is the densest of all the macronutrients. So you got to be mindful of going about with the different diets. You got to be careful about how the diets are being manipulated by different people. Yes, you'll have significant loss of weight, but the loss comes at a significant cost of reducing your protein mass or lean body mass. But whereas the keto diet or a high-fat diet essentially knocks down your insulin. When the insulin is not there, proteins are protected and you mobilize your fats. So let's compare the keto diet, the constituents of the keto diet, to the American Heart Association and the American Diabetes Association diet, and see why there's a significant difference. And let's talk about it in the next few slides. The first and foremost important thing is the carbohydrates. If you look at the American Heart Association and the American Diabetes Association diets, carbohydrates are the predominant source of energy. 50% of the diet, the advice is we should have around 50% of carbohydrates in the diet, and the keto diet is anywhere from 5 to 10%. The fats, 25% in the American Heart Association diet, around 80% in the keto diet, proteins 25%, and the keto diet more or less the same 10 to 20%. Saturated fats less than 7%, 6 and 7%, because a slight difference between American Dietary Association, Diabetic Association, and American Heart Association, but less than 7% is the standard, and I put it less than 6%. And here in the keto diet, some of the keto diets, which are first given out to us, there's absolutely no limit on saturated fat. There's a big push saying that saturated fats are not bad, like how the cardiology community, that's a different discussion that we're not going to go into right now. But there is no limit on the amount of saturated fats in most of the keto diets. Some keto diets say we want to have a very high level of unsaturated fatty acids, which are good for the body, and a low level of saturated fats. So again, I spoke about those two mechanisms as to how fatty acid oxidation happens in the presence of glucose and in the absence of glucose. That is the main takeaway point for the talk today. So no carbs and high fats, that is a keto diet. It's a perfect scenario for ketone body production. No carbs and high fats, almost no insulin, so decreased fat storage. Wonderful. You're going to mobilize most of the fats. But that is the caveat of this. So you're giving fat and you want fat to come out. So you got to be mindful of the calorie restriction. Because if your calories are here and your expenditure is here, then you will not be mobilizing the fat from the fat store because you already have a significant amount of fat left in the body, in the blood pool. So you got to be mindful of low calorie diet when I talk about the keto diet. You don't want to have significant amount of calories. And so you need to do the calorie count. That becomes an essential thing in people who are following the keto diet. And most of the fats are in the blood. Liver takes over and starts producing ketone bodies, again, like in the absence of glucose or insulin. And ketone bodies are then used for energy source, mainly for the brain. It's a protection for the brain. Ketone bodies are not bad for the body. Excess ketone bodies are bad because ketones, which are acetone, beta hydroxybutyrate, and estradiol, or 3-beta hydroxybutyrate, they are acid molecules. So as the level goes up, your pH goes down and your body goes into what's called metabolic acidemia or acidosis. Very, very careful. You got to be extremely careful about or mindful about that. Then, as I told you, the ketone body levels determine the outcome. Levels of around 5 to 8 millimoles, which are usually the levels that we find in a normal, well-regulated keto diets, or even in fasting, intermittent fasting, are good for energy production. So when the ketone body levels are 1 to 2 millimoles, they're barely there. They just supply, they're there like so that when our brain needs, we can get them in periods of hypoglycemia. But usually when you go on a keto diet or when you go on a fasting, the levels are around 5 to 8 millimoles. But when you go into the starvation mode, or when you go into the diabetic ketoacidemia or acidosis, the keto levels increase by more than 20 millimoles per deciliter. That is extremely dangerous. And in the medical community, patients with the diabetic ketoacidosis are one of the sickest patients. And we have to have a tremendous amount of urgency in treating these patients with diabetic ketoacidosis. Can keto diets produce diabetic ketoacidosis? Yes, they can. We'll discuss them further into the talk. Then, what are the metabolic effects or benefits of keto diets? Most important thing is weight loss. That's what keto diets have come up. Like we want to have weight loss because obesity is a very big problem in the world right now, irrespective of the socioeconomic status of the countries, irrespective. So obesity is going up in both first world countries, second world countries, developing countries, and third world countries. Absolutely no class differentiation there. And the reduction in appetite due to the high protein content and the high fat content is one of the major things like that you have the metabolic benefit. You go into what's called metabolic flexibility. I've spoken about it in my previous talk about the metabolic flexibility and biochemical composition of the body. It's a direct appetite suppressant. So we know that I spoke about it. Increased fat conversion. This is very important. And I will touch this again in the talk. Increased respiratory rate and increased energy expenditure, as we have discussed previously in the previous slides. So the proposed benefits in the different disease status or disease states. It has been proposed that it can have a benefit in the Alzheimer's disease because brain loves ketone bodies. So they said because of excessive carbohydrate, excessive glucose, like that can be one of the reasons for Alzheimer's disease because of increase in the oxidative stress. And so decrease in oxidative stress, decrease in your other inflammatory markers will have an effect on Alzheimer's disease. A lot of research is going on around there. Next is polycystic ovarian syndrome. So it is just like a metabolic syndrome where you have a problem with the fat metabolism and glucose handling of the body, and you have hypertension. And then the cancer, some of the cancers, because most of the cancers, it has been not proved, but there are lots of studies which say the amount of insulin in the body promotes cellular proliferation. So insulin is a mitogenic substance, meaning it increases the number of cells that are produced. So increased glucose, increased insulin, increased mitosis, increased cell production, and so that is detrimental in the cancer because cancer becomes big. As simple as that. So when you take away the insulin, because there is not this big paucity of insulin, a drop in insulin levels, you see a decrease in the incidence of cancer and also in the propagation of cancer in the body. Then epilepsy, this has been the first benefit of a keto diet has been in patients with epilepsy. It has been recorded even in the Bible too. Lots of years, like many years, we have this experience, and they do not have an exact explanation as to why you have an increased threshold of epilepsy, meaning you see less frequent episodes of epilepsy, but it has been a proved fact. And it has been used in children extensively since early 1900s. And then weight loss, we know about it. Coming to the cardiovascular benefits, it is known to decrease triglycerides. So this is a paradoxical effect. You're giving fats, but you decrease the triglycerides because most of the triglycerides in the body, when we eat, they'll be broken down into monoacyl glycerols and they'll be reconstituted again. But the thing is, you will not have excess carbohydrates to deal with. And so the liver preferentially converts the excess carbohydrate, which is glucose, into triglycerides, into the fats. So that mechanism is broken down by keto diet. Mindful that you have what is called a calorie restriction. And then insulin induces a specific enzyme that is the rate limiting step in the production of cholesterol synthesis. Now, lack of insulin, so technically, because insulin is not pushing that specific enzyme, which aids in the production of cholesterol, decreases the cholesterol production. So that is the proposed mechanism as to why your cholesterol levels will go down. Proposed mechanism, not definite, but proposed mechanism. And it has been shown to increase the size of LDL. LDL is a bad cholesterol. LDL has been implicated in the plaque formation. And the size of the LDL is also very important. The smaller the size, the more potent it is. The more oxidized the LDL, the more potent it is. So smaller LDL particles are more oxidized. So they are extremely potent in causing atherosclerotic plaque disease, which is, in simplistic terms, blockages the blood vessels. Diabetes, mindful, type 2 diabetes only. It has been shown to decrease glucose levels, and that leads to decreased insulin levels. So when you have decreased insulin levels, over a period of time, you'll see decreased insulin resistance by the muscles, and that will help in utilization of the glucose. So let's talk about the negative aspects of the keto diet. In the short term, it has an excellent benefit for blood sugar control. Excellent. There's no second thought about it because you're not giving any glucose or you're limiting the amount of glucose. And so when you're not giving the glucose, you'll have a phenomenal response of your glucose curves, both postprandial and fasting. And mysteriously, like fasting blood sugars are more or better off than the postprandial. And there's been some argument about that. But in essence, you will have an excellent benefit, excellent blood sugar control. What they've shown is prolonged carbohydrate restriction, particularly what they've seen in young kids. It has caused selective hepatic insulin resistance. This is a finding that is worrisome. So the liver is the most important organ in the body for metabolism. And prolonged carbohydrate restriction has been shown to cause problems with the liver as to how the liver handles the insulin. And postprandial blood sugar spike has been shown in animals. As I told you, the fasting blood sugars have been shown to be very low or well controlled, but postprandial blood sugar spike has been shown in animals fed on chronic. This is all chronic, meaning when you take keto diet for a long period of time. Instead of a drop that you see initially, slowly you'll see the spike is not as significant as was before. And high ketone bodies are associated with higher levels of inflammatory markers. Again, like this is going back, like this is a contradictory statement, what we found, what we proposed, meaning ketone bodies, because of absence of insulin, because of absence of glucose, like you will have, or decreased amount of glucose in the body, you will have a decreased incidence of, or decreased levels of inflammatory markers. But some studies have found that high ketone bodies are associated with higher levels of inflammatory markers. The stress is high. Is it because of the excess energy that you need for metabolism of the fats into ketone bodies? We do not know, or at least I do not know. And children on prolonged keto diet of epilepsy have noticed, they have found cardiac complications in children who are on prolonged keto diet. And most interesting thing is that the main problem in diabetes is this excess glucose that is present in the blood. Each glucose molecule will attach to whatever it finds and forms a special product, non-enzymatic attachment, and forms a special products called glycation products, AGE. These are the things which are extremely dangerous and the main cause for all the multi-organ system involvement that we see in diabetes. And ketone bodies have been shown that they behave similar to the glycation products in inducing vascular inflammation and also atherosclerosis, which is nothing but blockage of the blood vessels. So both plus and minus when you take the ketone bodies. So we are seeing, we have talked about the benefits of keto, right? Very good in short term. Long term, we've seen some proposed mechanisms where some detrimental things can happen. So people are moving away from keto diet. But do we have any data? So this is a paper that has been presented at ACC, American College of Cardiology, last year. And this is an UK study in the United Kingdom. 305 participants who are fed on low-carb, high-fat diet versus a normal diet. They're followed for close to 12 years. That's a long period of time. And what they found was higher levels of bad cholesterol, LDL, significantly higher. And ApoB, this is a phospholipid, like just don't worry about it. It's also a form of cholesterol, which is when it is high, it is just like your LDL. So that also has been found to be very high in patients, in this set of patients, in this study. And there was a 100% increase from 4.3 to 9.8% in new cardiac event, what we call acute coronary syndrome. 100% from 4.3% in people who are on standard diet versus 9.8% who are on a low carbohydrate, high fat diet, which is a typical keto diet. This is very disturbing. And that's why since last year, most of the cardiologists and most of the physicians in the cardiology community are moving away from advising keto diet. We don't have full data, but this is a distressing thing. 100% increase in incidence of coronary artery disease or a cardiac event is a very, very disturbing number. So one study, but definitely a significant issue that we cannot ignore. Okay, so keto diet and type 2 diabetes, which is the talk of the day, and I want to make it very simplistic. Early stages, you have high insulin levels, high insulin resistance, and so it is good within a short term. Late stages, we have decreased insulin levels because we burn off the insulin, because pancreas produces a lot of insulin in the initial phases of diabetes, and we burn off the pancreatic cells. And so in the end, in the later phase of diabetes, even if it's type 2 diabetes, will not have enough cells in the pancreas to produce the insulin or to mount an insulin response. But still you have a high insulin resistance. And so in the late stages of type 2 diabetes, which are insulin requiring, and when you have a burnout phenomenon, it is bad. So you have to treat it just like your type 1 diabetes. So do we have a good solution then? So we know that American Heart Association and American Diabetic Associations are not working properly because of one very simple thing, which is we have an excess amount of carbohydrates. So the argument has to be made like, yes, we have to balance out the macronutrients. And the problem is, how do we balance them out? And how do we go about in the future? Because the keto diet, as I've told you, the argument was it was very good initially, wonderful like in the short term, but in the long term, we're seeing some distressing problems, some very, very important problems that can cause very high mortality and very high morbidity, which is both the disease status and also increase in death rate. So we got to be very mindful of like which way to go, because people who are adhering to the American Diabetic Association diet are finding it problematic in getting what are called good carbohydrates. Good carbohydrates. That is the essence of the topic now, because we are deviating from the keto diet, from fats, to what are called good carbohydrates. Good fats, saturated fats are bad. Unsaturated fats, particularly having the unsaturated bond at omega-3 and 3 level, extremely good. So we know they're good fats. And most of the proteins are good. So we have very few proteins which got to be careful about, but most of the proteins are excellent. And now we don't have a concept of what is called good carbohydrates. So we have to find a solution where we have to make the recommendations of American Diabetic Association extremely good. So that is what has worked for a long period of time. But because of a deviation from unprocessed carbohydrates to processed carbohydrates, or to ultra-processed carbohydrate, to the decrease in the particle size, which is the essence in the processing of the carbohydrate. So as the particle size goes down, the quality of the carbohydrate goes down. The glycemic index of the carbohydrate goes up. So we have to find a solution which is better than keto, because keto diet essentially is good, but bad in the long term. And we have to find a solution for a good carbohydrate source. A good carbohydrate source is, or good carbohydrates are the ones which are long chain carbohydrates, which are complex carbohydrates, which cannot be digested properly. Okay, so in the American Heart Association, the carbohydrate content is 50% advised, and keto diet is 10 to 20%. And then we have suddenly, like now I'm putting in like Rubyroti, because we have come up with the Rubyroti. And so this is the essence. We wanted to give good carbohydrates, which is almost 40%, which is close to what the American Heart Association and some of the studies like now have given that, which is almost 2 times or 3 times or even 4 times the amount of carbohydrate that is present in the keto diet. In essence, what you're doing is, the way that our team developed this product in the essence is, we want to balance out. We want to use fats as the primary mode, because fatty acid oxidation in the presence of carbohydrate. Remember, I told you fat burns on carbohydrate. So when there is enough carbohydrate that is present in the body, you invoke a lot of fats. But fats won't come when you have a high insulin level. So you got to decrease the glycemic index, but provide enough amount of glucose so that your fats are mobilized and they are used in the energy production for the which is the essential thing, like for the requirement of the body. I hope I'm not making it complex. So simplistically, we want good carbohydrates. We want to have carbohydrates that are hard to digest. At the same time, we want to bring out fats from the fat stores. As simple as that. And when you come to the fat sources of our Rubyroti, it's 16%. Compared to 80% in the keto diet, compared to the 30% in the American Diabetic Association. So, and then the saturated fat is less than 3% in our diet. And this is on the right side, like you see, one of the many nutritional analyses that we send for the nutrition labs. And then, as I told you, we want to have an extremely low glycemic index product, good carbohydrates, good amount of fats, good amount of unsaturated fats, and very low amount of saturated fats, which is exactly the formula that we've used in making of the Rubyroti. So the GI of Rubyroti compares to keto diet. If you do not have any glucose, any amount of carbohydrate, meaning if carbohydrate is zero, then you will not have any glucose spike, as simple as that, which is the 100% keto diet, 100% fats. But when you have an ample amount of carbohydrate, which is 39%, so, and we have around 20% of that carbohydrates as fiber, both soluble and insoluble, which we have put in Rubyroti. The rest of the carbs, which are around 20% of net carbohydrates, which can be used for the glucose spike, which will have an effect on the glucose spike, are good carbohydrates because the glycemic index is so low. So the carbohydrates that you get in the Rubyroti are extremely good carbohydrates. So you are giving very good fat source. You're not getting saturated fats in the Rubyroti. You're getting good amount of unsaturated fatty acids, which is good for the body. And then you're going to get good carbohydrates for the body. So this is our nutritional breakdown. As I told you, like protein content is 34%, fiber is 20%, and the net carbs are around 19. So 19 grams per every 100 grams. That is what gave us the advantage of going so low on the glycemic index. And the most important thing is we have such a very low glycemic load also. So key takeaway points. These are the things that I want to reiterate again and again. Keto diet is a big no in type 1 diabetes. It is also not good for late stages of type 2 diabetes requiring insulin. Not so good. It is okay for a very short period of time. It is okay to have a keto meal once in a while. So 4 takeaway points. And I think we should, we'll be open for Q&A now.
Yeah. So Dr. Raghu, first of all, thanks a lot for going into the details on the keto diet and explaining the foundations of, the biochemical process and pathways, and explaining the foundations of how it can actually play a role in, different metabolic cases. So just to the people who are actually listening, if you have any questions, please, as I've said before, please do type in the chat box. In the meantime, I have a few clarifications that I'd like to make, right? So a few questions actually. So Dr. Raghu, you categorically said that keto diets are very bad for type 1 diabetes and type 1 diabetics should stay away from keto diets. For type 2, you did make a qualification saying that early stages of type 2, it's okay, but later stages of type 2, it's not good. I have a few follow-up questions on that. Firstly, how do you define what's early stages of type 2 and later stages of type 2? Is it on the medication dosage or insulin or amount of insulin that you're taking into body?
Yes. So type 2 diabetes, the most important thing is you have insulin resistance. So initial phases of type 2 diabetes, you have very high levels of insulin. So you are okay with going with a keto diet on a short-term basis. But as the insulin levels goes down, your body requires insulin because you are behaving just like your type 1 now. In the late stages, it's called insulin requiring diabetes mellitus. It's not type 1, meaning like you don't have it completely, but here you have some insulin production, but that is not enough. So you boost your insulin levels, you give supplemental insulin, but the problem is you already have a high insulin resistance, and so the insulin requirement goes up significantly. So dietary management becomes extremely important in patients who are in the end or the final stage or later stages of type 2 diabetes, wherein you require insulin, number one. And number two, what happens is in type 2 diabetes, the first thing is insulin has a bimodal way of production. So as you eat, when insulin and the body senses glucose, there's a sudden spike of insulin, the initial spike. And then later on, you have what is called a plateau phenomenon. So in type 2 diabetes, in the early phases or in the later stages, you lose the initial spike of insulin. And that's why in some people, that's why I'm not going to tell what to do. You got to go and follow the endocrinologist. The endocrinologist says you need insulin they must have checked you up very well and seen the response of what is happening with the glucose curves and happening with the insulin levels. And that's when they always advise like insulin. So when you require insulin, you got to be mindful of a keto diet.
Right. And also, so just to follow up on that one, right? So what if I were to come over and say that, so let's say I haven't actually, my insulin resistance hasn't really gone that high and I'm still in early stages of diabetes. Let's say I'm a pre-diabetic, right? So what's the harm in me actually just using a keto diet and being in that phase? Would 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 I still progress to an advanced stage of type 2 diabetes if I was able to identify in pre-diabetic stage and just follow the keto diet?
Not necessarily. Like now, most of the studies have shown that it's an excellent way to control the diabetes. There's no question about it. But what we are seeing is the other aspects.
Mm.
People have shown in the long term, the postprandial blood sugars are going up. In the long term, ketone bodies are behaving exactly like your glycation products, which are extremely dangerous for your body. So similar products. Number three, they have found, even in children, they have found problems with cardiac problems, cardiac issues. And so all these things put together, and the study that I've quoted, and there are some other studies that are coming out saying the very high levels of LDL, which is bad cholesterol. We wanted, initially we said like there's a decrease in the triglycerides, decrease in LDL levels because of the keto diet. But what you're essentially doing is you want to move into fat metabolism, which is extremely good. There's no second thought about it. But you're giving so much fat in the keto diet. And if it is not regulated, if it's not matched with the calorie count, you are essentially not pulling out any fat from the cells because you already have a lot of fats in the blood. So you move the fats out of the cell when there is a decrease in the fats and when you need more energy than what the fat content is present in the body, in the
Hmm.
blood.
Hmm.
So now the balance is disturbed, meaning like people are eating a lot of keto diet, more than like their energy needs. And so your fats will not be mobilized because you already have fats in the system. So you don't need like more fats than like what you require. And so when you have more fats in the system, that's when you end up in problems with like your LDL. That's when you end up problems of what to do with these extra fats like in the blood. So they may be like attached to somewhere. And so all these other problems that we're seeing can be because of unregulated keto diet. And there is a movement towards use of unsaturated fats. So the content of the unsaturated fat has to go up in a keto diet compared to the saturated fat. Some people say, look, that's a good way of like monitoring your keto diet. But mindful, got to be very careful because there are lots of people with the keto diet got to be extremely careful about if certain conditions. And so if somebody wants to go on a keto diet, they have to take medical advice without fail. You cannot just go about and start a keto diet without medical advice.
Right. Okay. So in that sense, you've already clarified in your presentation that in the later stages of type 2 diabetes, you should stay away from keto diets. And you're also saying that in earlier stages, yes, you can actually use keto diets, but the problem is you're not concerned with diabetes at that point of time. You're concerned with longer term complications of keto diets on, let's say, cardiovascular system and other things that you're talking about,
Yes.
right?
That is the keto diet like in non-diabetic patients.
Yes. Yeah.
Yeah. Yes.
Okay. Okay, so that means that the same argument would also extend to somebody who's actually looking for a weight loss solution as keto diet as a weight loss solution as well. I presume would that be the same problem that
Yes.
you?
Yes. Yes.
Okay.
Because this is all weight loss is not like 5 weeks or 6 weeks thing because
Hmm.
you have to maintain the weight loss. So you want to stick to the keto diet for a long period of time. And the major problem that most of the people have is adherence of keto diet in the long-term basis because it's very, very hard to maintain that level of fats in the system in your nutritional profile and eat it continuously because it becomes very, very distressing like for you to adhere to the diet. That's one of the
Right.
main reasons. That's why people do not stick to keto diet on long-term basis.
Yeah.
It may be
Um,
good for them if they stop it.
so sorry.
It may be good, like if they stop it, like if they don't use it on a chronic basis, like that may be actually good for
Yeah.
them.
Right. We have a couple of questions here. So the first one is from Arndam Nandi. So he's asking, my height is 5'9" and I weigh 84 kilograms. So it's clearly indicates that I'm overweight, if I'm suffering with high SGPT and SGOT, so in that scenario, how long can I stretch the keto diet for fat loss? KFT test is normal and the others of LFT test is normal.
Now, this is, yeah, when you have problems like that, you got to be very careful and mindful. I want you to go and see an endocrinologist before you continue on the keto diet. As simple as that.
Okay. Yeah.
As simple as that. Like you do not want to push the keto diet like to the extreme.
Okay. Yeah. And there's another question on from Anisha. Does keto diet help for cancer patients?
It has
Okay.
been, yes, as I've told you in the presentation, keto diets decrease the glucose levels and thereby your insulin levels go down. And as the insulin levels go down, because insulin is mitogenic, meaning insulin promotes cellular proliferation, cellular growth, cell replication. So because you take away insulin from the system, the proposal was your keto diet helps with some cancers.
Right. Okay. Okay. So in that case, I think we'll close the webinar now. Uh, uh, Thanks a lot for asking your questions and listening to us. I hope that this talk has actually really helped you understand the foundations of keto diets and where you'd want to use them and where you wouldn't want to use them. By and large, it looks like what Dr. Raghu is saying is whether you're diabetic or not, you probably want to stay away from keto diets. Do it once in a while, but don't do it for longer periods of time because there are other aspects of keto diet which impact other systems in your body. With that, thanks a lot, Dr. Raghu,
Yeah,
for
I have one comment, like I always want to have a comment in the end.
yeah.
So such a complex metabolic things happen when we talk about fats, carbohydrates, how they're metabolized in the body, how they're utilized like with energy utilization. The problem is to explain that in a simplistic terms is one of the major challenges for the medical community. Because of the complexity of what happens in the body, both with a high carbohydrate diet and a low carbohydrate diet and a high fat diet, because of these complexities, people try to, most of the influencers or whoever like proposes keto diet, they give a very simplistic explanation saying that we will treat your diabetes in 2 months. We'll treat your diabetes in 10 days. We'll treat your diabetes here. You'll have a significant weight loss. But to explain why that happens, what is the essence, and the key takeaway point is we need fats, and the most important fuel source in the body should be fats, but these fats should be utilized by every cell in the body, and that utilization of the fats by every cell in the body happens in the presence of glucose. When you take away the glucose from the body, that's when your ketone bodies come in. Are they good for the body? They are relatively good for the body, but the level should be maintained. And most of the diet do not have very high levels of keto diet, but in some situations of extreme infection or starvation or some other problem, metabolic pathways and some problems, you can go into ketoacidosis. And the typical example is diabetic ketoacidosis. Even type 2 diabetes sometimes can go into diabetic ketoacidosis depending on the diets that you're on. So you got to be mindful when you go on the keto diet, be very careful about short-term basis only. That is what my advice would be, not on long-term basis at this point, to the best of my understanding.
Right. Right. Thanks a lot, Dr. Raghu, and we'll see you in the next webinar. Thank you. Bye.